the Novilase clinical trial represents a real paradigm shift in the treatment of breast cancer, taking it out of the operating room and into a more comfortable breast center environment under local anesthesia where you're essentially in and out in an hour getting complete treatment. The procedure is actually really simple. It uses thermal energy, laser energy, as opposed to traditional operating room knife and scalpel and anesthesia to take care of your cancer. So instead of going to an operating room where we physically cut out the cancer, leaving a scar, the Novilase procedure uses a laser probe, which we insert into the cancer itself under ultrasound guidance to treat the cancer. We heat the cancer up to a certain temperature, it automatically kills the cancer cells, and then once we remove the probe, we just have to put a Band-Aid on these little pinpoint incisions that we have, and you're done. The patients so far that have done the trial are ecstatic. They really act as their own controls. The original patients have come in, they've had their cancer treated with laser under local anesthesia, after which they've gone home, had a nice dinner. A few have actually gone back to work, which I wouldn't recommend, but that's how easy it is. Then a month later, when we were first testing the trial to make sure that we actually had total tumor kill, they would come back and the tumor, the cancer that was treated, what was left of it, would be completely excised and evaluated. And we really have gotten total tumor kill. Those patients in those scenarios obviously are comparing their experience with the laser Novilase treatment versus traditional surgery. And each and every one has said it's unbelievably amazing how easy it is to have the cancer treated with laser. I mean, if I were a patient, I would say, I want that. How can I get that? Well, one thing that patients need to know is that this is for early stage breast cancers. It's for small breast cancers. So get your mammograms, do your exams. If you do have a cancer and it's an early pickup, you will be a candidate for these very easy, convenient treatments. And those are the people that will benefit. So early detection is cure. Get your mammograms, get your ultrasounds. Some people are afraid of clinical trials. They really shouldn't be. We've already done this with laser for many years. First, a very famous gentleman, Dr. Kimby Dowlott, worked on it in a rat model for years and really worked out the laser technique. He then treated 50 patients with laser independently and got significant results, wrote a very famous paper about it. Since then, now we're starting to apply that to multiple institutions, which is how clinical trials work, to make sure that in repeated, well-trained institutions that we can reproduce his results. And so far we have. Clinical trials, as a rule, don't make huge leaps in how we treat cancer. Everything is done in baby steps. But if you look back, initially we were doing mastectomies for breast cancer, then we started doing lumpectomies. We used to do these big radical lymph node dissections to see if the cancer has spread. Now we're not doing that anymore. And so obviously this is taking this into the next step in treatment, no longer doing lumpectomies, but allowing the patients to be treated minimally invasive with a laser probe. Just a tiny little incision, the breast looks just the way it did after the treatment. There's no change in contour, in bleeding, in shape, your clothes fit. People are really happy about that. Laser technology is actually quite an old concept. I mean, we were using it when we were doing gallbladder surgery 20 years ago. We're just now bringing it into new arenas that doctors find very exciting. Obviously, breast cancer is always a very high-profile, emotional arena to bring new treatments into. It's always very readily acceptable. Women are always willing to step up to the plate and be involved with moving progress forward. The laser, however, will have multiple applications, not only for breast cancer, we're also looking at it for prostate, for liver metastases, and I think really we'll just begin to go from there. Lots of opportunities. This really represents a change in healthcare, which we need. That it takes a very common problem, breast cancer, and allows treatment to be in a much different, simpler more convenient arena and still aim for cure. Look at the site, contact that center, and I'm sure the Novilase personnel will help you with that, so that we can see if you qualify for the trial and then make sure you have an appointment so that you can move forward.